the way I've sort of talked about it, maybe even on the podcast, but certainly the way I talk about it with patients every day, it would seem, is I describe it as a 2x2 matrix. Um, so we think about how this test is helpful in people who are young and people who are old. Now, I usually use 50 as the cutoff. It sounds like you use 60 as the over under, but let's just say it's somewhere in that sixth decade. And then is it zero or is it non-zero? Um, and I agree with what I'm hearing is your assessment, which is in the older patient, the positive score is not very informative. So when I have a 70-year-old patient whose calcium score is 50, it's sort of like, so what? Like you're normal. That doesn't tell me much. And conversely, when I have an older patient whose score is 0 and they're adamant about not getting treatment, it becomes an easier decision to accept, because you can say, well, gosh, you're pretty fortunate to be 73 years old, and despite having an ApoB of 140 milligrams per deciliter, your calcium score is 0. There must be some other protective mechanisms in you.
Yeah, the bounds of our knowledge are really quite limited. And
Yeah.
it's important that we admit that to ourselves and to our patients as well. I look at it maybe a bit differently. I say, yes, I would say the same thing. And I would say, yeah, but even so.
Well, yes, to me, there's an asymmetry, which I want to come to in a moment. On the flip side of things, the young patient who has a positive calcium score, really, that's a 4-alarm fire, regardless of the ApoB, right?
Okay.
So if you're under 50 and you have a speck of calcium in your coronary arteries, even if it's a low enough speck that it would predict a 10-year risk of 4%, that's still utterly unacceptable.
Oh no! If it's positive, it's positive, and it's only going to go up.
Exactly,
You know
and more to your point, it's what it says about the milieu of the entire system. So that might be the one area in the middle of your left anterior descending artery where you're at such an advanced stage that you've already laid calcium there. But, it's sort of like looking at the concrete that's been poured over Chernobyl and trying to infer what's going on in the 10 miles around Chernobyl. It's all bad.
Yeah, that's correct.
Where I find the most challenge is in there's the group think that says if a person's calcium score is 0, no treatment is needed. And this kind of gets back to your paper from JAMA, I think 2018, maybe 2017, looking at the 30-year risk, the causal model, which I want to come back to. You mentioned it very briefly at the outset, but it's so important that I want to now use this as a jumping point to go there, which is you take that 45-year-old person who you expect their calcium score to be 0. It is 0, but their ApoB is higher than it should be, or you would like it to be. That calcium score of 0 hasn't really added much information to my decision making.
No, because your time horizon is different, and I think that's what in those studies we use 20, 30 years. Okay, I think the 10-year. If you're 45, you want to get to further than 55. Your career, your children, your enjoyment of things. Surely you're not just planning to age 55. And you should be thinking, well, what am I going to be like at 65 or 75? That's reasonable. And it's also, by taking it out to that, you can get to numbers that are really meaningful. When somebody's at a 30% chance, like 1 in 3, that's a number most people can understand, and it starts to become a truly individually meaningful number for an individual. When somebody's at 7.8% risk, That's tough to absorb in any way that means something.
This podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions. Finally, I take conflicts of interest very seriously. For all of my disclosures and the companies I invest in or advise, please visit peterattiamd.com/about, where I keep an up-to-date and active list of such companies.